All right, welcome back, class. Chapter 10, Principles of Oxygen Therapy. Importance of oxygen. So, oxygen for us is a drug. It's a medication, right? We're licensed to carry it and give it to patients as a medication. The concentration is how much is being delivered to the patient. So, the air we breathe, we mentioned in the last lecture, is 21% oxygen. Supplemental oxygen is 100% oxygen. So, in our oxygen bottles, that's 100% oxygen. A common misbelief is that inside the firefighter SCBA air tanks, that is 100% oxygen. But that's not the case. That's just compressed air. So there's only 21% oxygen in a firefighter's air tank. And there is 100% oxygen in the green oxygen bottles we carry. So why might they need it? Maybe they have respiratory cardiac compromise, cardiac arrest, obviously they'll need it. Shock, major blood loss, injury to lung or chest, airway obstruction, stroke. Any number of reasons can cause a patient to need oxygen. So common signs, altered mental status. So for whatever reason, if they're confused or just don't know what's going on, maybe their oxygen level is low. Abnormal vital signs, maybe their pulse oximetry level is way low. A significant mechanism of injury, a big car accident, say they hit a tree when they were skiing, something like that. Or an increased level of distress. Maybe they're just panicking. A lot of times you put them on oxygen and whether or not it's a placebo effect, it seems to calm people down. Oxygen saturation. So per the AHA, oxygen, we want to keep it between 94% and 99%. Just remember that, okay? So oxygen, we want it at 94 to 99. And we monitor it with a pulse oximeter, which I'm sure you've all seen on the calls. Hazards of oxygen cylinders. So every oxygen bottle that I've seen is under 2,000 psi. If the tank is punctured or a valve breaks off, it's going to become a missile. So we never stand them up because they could fall over and then fire off. And oxygen itself is non-flammable, but it greatly increases the rate and intensity of combustion. So, and also oxygen and oil don't mix. Believe it or not, you will at some point in your career probably go on a patient who's wearing a nasal cannula and cannot help but smoke a cigarette, and it basically blows up in their face. And they always seem fine, but they are charred around their face, and that is very risky because maybe they burn their airway, and it may not be swelling shut yet, but it could later. So don't underestimate the dangers of oxygen. What's crazy nowadays is that every ambulance that you get comes with a sign that says no smoking oxygen on board, which I would think is a no-brainer, but apparently we have to label that. What safety precautions should the EMR take when working with oxygen cylinders? Never stand them up alone. Like when you store them in a station, they're supposed to be like in a rack or chained against the wall, something like that. The green placards that the DOT uses is typically for the gases. That's typically what you'll see when they're carrying oxygen. Oxygen therapy equipment. So we have our oxygen source, which is our bottle, the regulator, which helps us, deliver a certain flow delivery device. That could be your nasal cannula, your non-rebreather, your BVM. A humidifier, I've never seen one used. Oxygen cylinder, so that's going to be your seamless steel or aluminum cylinder. For the most part nowadays, they're all aluminum. You do see some steel ones floating around here or there, but those have kind of been phased out because they're so heavy. So here's a picture of your non-rebreather, a nasal cannula, your regulator up there top, and the oxygen bottle. So there's different sizes identified by letters. So the D cylinder, so that is the cylinder that we carry. You've got your jumbo D cylinders or E cylinders, and those are the ones you typically put inside the ambulance. They're like a giant tank. But for us, the D cylinder is what we carry. So ours is the D, it's in the middle there. So every regulator will have a pressure gauge on it to tell you how much PSI is left in the tank. Never allowed to go completely empty, and never allowed to fall below 200 PSI. So at every agency that I've worked for, typically we change it out when it gets to the red, when the pressure gauge is in the red, and that's typically the red starts at 500 PSI. So you can go a little further, but we just don't like to risk it, and we'd rather swap out to a new tank when we drop into the red. So safety when using oxygen. Never allow smoking. I hope that's an obvious one for you guys. Don't use it around open flames or sparks. Never use grease or oil. I don't know why you would, but they did include that in here. And never put tape on the cylinder. That I'm not sure why either. Maybe one of you that's a lot smarter than I am could tell me why. Because we sticker them. I mean, we put stickers on them, so I don't know why they would say that, but never store it near high heat or in a closed vehicle parked in the sun. Like I said, keep them lined flat. Use pressure gauges and regulators. Make sure the O-ring's in good condition. If it's not, it'll be leaking, so you'll hear it. Make sure the connections are only hand tight. Open and close all the valves slowly. Keep them in a cool ventilated room and have them hydrostatically tested. I think it's every 5 years they have to be tested. So pressure in a full oxygen cylinder, no matter the size, is 2,000. So the regulators have 3 functions. So they reduce the tank pressure so we're not blasting the patient in the face with 2,000 PSI. They show us how much oxygen is in there, and they control the delivery. We can set it to different liters per minute. There's a picture of an oxygen tank with a couple regulators. So there's a pin index system to connect it. I don't know if you guys have all had a chance to do this, but if you haven't, I'd play around with it. Make sure the oxygen tank's shut off, bleed it, so that if there's any oxygen in the regulator, it's gone, and then take it off and look at it. The largest pin is the oxygen port, and then there's 2 pins, so you really can't put it on the tank wrong. So here in this picture you can see the oxygen tank has those 2 little holes and the big hole. So the big hole is where the oxygen flows in, and then the regulators have the 2 little pegs that go in those holes, and then the big peg with the O-ring around it. So the humidifiers, what they do is it's an unbreakable container of water, and the oxygen basically humidifies, or it humidifies the oxygen so that it's more comfortable for some people to breathe. It doesn't dry up their throat and stuff like that. But like I said, I've never seen one used. I think when I worked at Gold Cross back in 2006, they carried them on the ambulances, but we never used it. And since then, I've never seen one. So I mentioned these a little earlier. So we have the different devices. You have your nasal cannula. I'm sure you've all seen that on a call. A lot of elderly people just wear them all the time. It's used to deliver only low concentrations of supplemental oxygen. Okay, so 6 liters is the key there. You want to go 2 to 6 liters. I would never do anything more than 6 liters. A non-rebreather mask used to deliver high concentrations of oxygen. That would be 10 to 15 liters. For testing purposes, it's always 15 liters for a non-rebreather. For testing purpose for cannula, always 6 liters. There's a great picture of a nice young lady wearing a nasal cannula. So a non-rebreather mask has a face mask, a one-way valve, and a reservoir bag full of oxygen. Always inflate the bag before placing it on the patient's face, and always ensure adequate oxygen flow of 12 to 15 liters per minute. Some texts say 10 to 15. Just depends on which book you have. Here's a non-rebreather and a nice gentleman wearing a non-rebreather. You see that reservoir bag that just fills up with oxygen. It's got these little circular tabs there on the sides. I don't know if you can really see them. They're kind of a beige color to prevent air from flowing back in. A Venturi mask. I don't see these a lot either. So it's got adjustable jets that allow the user to more accurately determine specific oxygen concentration. I've never seen them in my career, so I don't think they're around much, but I guess they're out there still. Blow by. So this is where you just hold it in front of the patient's face and they get it. So maybe they don't want the mask on their face. They don't want to wear a cannula. It's great for small children. I've never really used it for an adult because they just need to be an adult and wear the oxygen mask. But for kids, this is a fantastic way to do it. Believe it or not, they get plenty of oxygen this way. It helps a lot if you have the parent or somebody hold the oxygen device. If the child's sleeping, you can just lay it right by their face. So it just works out great. They even have some like stuffed animals that have like an oxygen port. You can hook the oxygen tube into, and then the air just flows out of the stuffed animal, or the oxygen flows out of the stuffed animal, and those are great too. So think about, what is the length of time an oxygen cylinder can be used? Well, it really depends on how large the tank is. They all have 2000 psi, but the larger the tank, that 2000 psi may have more liters of oxygen in it. And how often should we check the regulator for adequate pressure? I would say after every use, I would check it. Because if you're not, and you get back and you don't check it and you go on the next call, you might be out of oxygen. Administering oxygen. Step-by-step process of preparing oxygen delivery system and administering oxygen. All right, so 3 devices. You've got your pocket mask with oxygen inlet, a bag mask device, or a demand valve device. So a demand valve device, excuse me. So that's going to deliver oxygen through the regulator, and it can go up to 100% oxygen on demand when the patient inhales. So in order for them to get air out of this, they have to breathe in. So like our regulators on our SCBAs are on-demand regulators, which means air doesn't flow out until we breathe in. So it's an on-demand regulator. So just monitor them when they're doing this, make sure that they're able to get the air out. Let's see. Explain to the patient before you just go to put a mask on their face. Tell them what you're doing. Make sure it's fitting good, and make sure they're comfortable. If they're uncomfortable, have them hold a non-rebreather first to their face, so that way they can get it comfortable, and then put the strap on. General guidelines for oxygen therapy. Let's remind the patient to breathe as normally as possible. They're going to be anxious, reluctant to accept the device, and if they are, just try to calm them down and keep a close eye on them. Keep that pulse oximeter on them. One thing that I would always recommend on every call is try to get a pulse oximeter reading before you give them any oxygen, because it's really important to see what their room air oxygen saturation is, because once they're on oxygen, you don't know their oxygen level is probably going to be normal. So you may miss a problem. So to me, a room air oxygen saturation level is vital. So I would always immediately put that on, wait till I get a reading, and then if it's below 94, then I would decide on whether or not I'm going to do oxygen therapy.